Hello, my name is Dr. Sanjana Velu, and I'm going to be diagnosing you today. If you wouldn't mind, can you tell me a little bit about yourself, your name, your job, your background, your family life?
So this is Dr. Mohammed speaking. This is your patient. You see in the screen. Welcome, Sanjana, and her name is Rukaya Hassan. So tana gaishe ki. Sunanta Sanjana tana gaishe ki. She says she's also nice, happy to meet you,
Okay.
and she said she is 20 years. Shekaran ki no? Okay, kina da yarinya ne? All right. She said she's 20 years old. She's married. She has a daughter.
Okay.
Yeah.
Um, would you mind asking her what brought her to the hospital today?
Okay. Wai za ki iya faɗa mata me ya kawo ki asibiti? All right. She said she's having fever, headache, and body weakness.
Okay. Can you describe the fever a little bit more in detail? Is it intermittent or is it constant throughout the day?
So ciwon nan yana zuwa ya tafi ne ko kuma kowane lokaci kike jin shi? Okay. All right. So she said the fever is it comes and go, and
Okay.
it's more in the evening. Yes.
Okay. Are you feeling any other symptoms other than the ones you just mentioned, like any chills or anything like that?
So banda wannan da kika faɗa akwai wani abu da kike ji a jikinki banda shi? All right. She said she's just having a general body weakness and no any other symptoms.
Okay. And
Yeah.
how long has this been going on?
Yanzu kwana nawa kike fama da wannan rashin lafiyan? She said she's having it for 3 days now.
Okay.
Yeah.
And could you describe the headache just a little bit more in detail? Is it more generalized or is it a sharp pain on any side?
So ciwon kai din gaba ɗaya kai din ne ko kuma wani bangare ne a kai din? Kuma ya kike jin ciwon yana bugawa ne ko kina ji kamar suka ne hakan nan? All right. She said the headache is generalized.
Okay.
Yes.
Is she feeling any other symptoms like nausea, vomiting, abdominal pain, anything like that?
Kina jin kamar ko ciwon ciki ko amai ko gudawa? All right. She said she's not having any vomiting, no abdominal pain, but she's having nausea.
Okay.
Yeah.
Is there any runny nose, coughing, sneezing, or any symptoms like that?
Akwai tari ne ko majina a hanci ko atishawa? Okay. She says she doesn't have those symptoms.
Okay.
Yeah.
And has she been feeling weak or very tired at all lately?
To kina jin kaman baki da ƙarfi a jikinki ne kaman kin gaji gaba ɗaya? Okay, she says she's having some weakness in the body, but not that severe.
Okay. Doctor, would you mind checking her eyelids or pulling her eye down to see if it's yellow or pale at all?
Okay, let me check. Bari mu duba idanki. You can see the conjunctiva. She's not pale actually.
Okay.
Yeah.
Would you mind asking her if she's does her skin look pale? Just looking at
No,
it?
no, the skin does not look pale.
Okay.
Yeah.
So I'm suspecting a case of malaria, but just to confirm, I'd like to run a rapid diagnostic test. Dr. Muhammad, can you hear me?
Ƙaran jin ɗin yana dan interfering, shi yasa muka rufe. So please, can you
Would you like me
Your
to
network
repeat
was
that?
bad. Wallahi ai bara mu iya sani bane ma in daga wajen mu ne ko daga wajen su. Hello, Sanjana, can you hear me?
Hello. Yes, I can hear you.
Yes, please. You can go ahead from where we stopped, please.
Okay. I'm suspecting a case of malaria, so would it be possible to run a rapid diagnostic test?
Okay. Yes. Rapid diagnostic test for this patient revealed 2 pluses of malaria.
Okay.
Yeah.
And just to confirm, can we take the patient's hemoglobin levels?
Yes. Her hemoglobin levels is 13 grams per deciliter.
Okay. So it
Yeah.
does not look like she does have anemia because her hemoglobin levels are well above normal, so that shouldn't be a problem. But it does look like she has an uncomplicated case of malaria. And so I'd like to diagnose her with, because it is 2 pluses, an uncomplicated case of malaria with no other side effects or anything going on.
Okay.
And to treat this, I'd like to prescribe an ACT to
Okay.
overcome resistance. It's a combination therapy, and because it is an uncomplicated case, she won't need an IV or anything like that.
Okay. That's
And
good.
yeah, and to make sure this does not happen in the future, some prevention techniques that can be used are using an insecticide-treated net in her house, and that way insects can't or mosquitoes can't come into her house and bite her because that is how malaria is transmitted. Also, wearing long sleeve shirts and pants can help prevent mosquito bites. In
Okay.
addition, you can use mosquito repellent to avoid mosquitoes and stay indoors after it gets dark out. And that can prevent mosquito bites, which are the cause of malaria.
That is very great, Sanjana. This patient actually has malaria, and you're able to know that this patient has malaria from her history. You were able to know it, and you did the correct investigation to confirm your diagnosis, which is RDT, which confirms that she has the malaria, 2 pluses of malaria. You also did well by trying to rule out anemia, which is one of the most common complication of malaria. You did very well, and also you suggested the correct treatment for this patient. For uncomplicated malaria, we give oral ACT, which is stated very correctly, and you also suggested future means of prevention, which is very good. Wearing of long pants, long sleeve shades, and also use of mosquito repellents. That is very correct, Sanjana. You have done very well. Congratulations.
Thank you.
Yeah.